We're back with Mimi. This is going to be your third treatment on your neck. And I feel like we wanted to add more of the side and the front of the neck this time.
Beautiful.
How are you doing? Let me see your range of motion. How's it feeling? Where do you feel like you're stuck?
Right here on this side. It's almost like a little crunch when I get to like right there. But it's so much better. Even back further, like right in there.
You know, I don't even know if we need to do front because I'm going to be able to thread through this whole thing with you face down.
That muscle. And it's more on this side than this side. Right. It always has been for some reason. But it's so much more relaxed and not so tight. And I feel like I can turn my head further in each direction and up and down without pain.
Great. So you're responding really well.
Yeah.
We just literally started. So we're going to do face down treatment, more so on left, which is going to be great for you guys to see. And I'm going to thread through to the medial, more anterior, and hit it from that side and go down the trap into the vater scapula and do the scapulas as well. And then we're going to check your low back. So we'll be in a minute.
Yeah, beautiful.
All right. Look over your feet. What's going on with this toe? You have it on both sides.
Yeah.
What is that? Yeah, it feels like your tendons are pulling. So you're just going to want to counterpose, like stretch this the other way. You feel what I mean? I'm going to go here and then here. So we are threading through the erector spinae, both sides to the periosteum. We're threading through, coming up to the underside of the SCM, nabbing the scalings, all that fun stuff. Remember, when you start to come off the neck, you want to start working transverse and not down into the area where the top of the lung is. I'm up on suprascap. I'm on this bone. I'm on suprascap. Again, all of these needles are going sideways, not down. We're threading through. Here. If you feel like you're going in too deep or too long, or for whatever reason the patient doesn't love it, just pull, just release a little bit. Tag the motor point and adjust. That way the muscle can actually relax instead of firing on the needle. All right, we'll let her sit. I'm going to do a spot treat with Mimi with 30s. I have 30 by 40s. Just to get the last little bit of this out. There it goes. This is called sea turtle hunting for cave. Did you feel that? Go around. There it goes. And locate the knot that won't vesiculate open and grab it. So sometimes when somebody's orthopedic area, regardless of the area, is completely locked up, do a full treatment like I showed you, where you're blanketing. What's not truly injured and annoyed will lay down first and let go. What's injured or not getting a good blood supply is ischemic, in effect, is what would be left behind. So if you want to be thorough, make sure that you are taking enough time to go back in and do what I call a spot treat. You can use a heavier needle. Also, this way, the patient won't be as sore. If you partially vesiculate an area and don't allow the body to resolve the problem more thoroughly, sometimes this metabolic waste and cellular debris can remain trapped in the tissues. You see how that's still vesiculating open? If you give the body a second to relax and get it from a different position, you'll have better results with your patients. And yes, you'll get them better a lot faster, but then they tell everybody they know how great you are. So it's a win-win. You want your patients to get better faster because you don't want this to go on forever. You want them to be able to move on and go to maintenance. And if they love the work you do, they'll come in even when they feel better. So we're going to go ahead and pull these, and I'm going to recheck. So it took me less than 5 minutes to just be more thorough with her. Using a larger needle, you might get a little bit of leakage, and that's completely fine. There's some schools of Chinese medicine that bleed patients on purpose. Any type of small bruising will keep the immune system there longer, cleaning up the area. So it's not a negative to have some small bruising. Do you feel the difference? Mm-hmm. It's like night and day. Yeah. And it just took me 5 minutes to be thorough. Circulated already. So the patient is still releasing in those traps. It's hard to pick it up on camera. No THC, just CBD, menthol, other herbs. I love this roll-on. I have it in a cream and a roll-on. It's prescription, so ask your acupuncturist to find this company. It's amazing.